next speak is Sam Wuest. He's an acupuncturist, also a Daoist Gate organization, and a student, also the Daoist conference organizer and a hoster. He's as follow me, like many years. He went to New Hampshire. Many years ago, he followed me from Boston. That during this time, I study about internal alchemy and Taiji, Qigong, Kung Fu. Like before he was living in Boston, always come to my center. Now he living in Costa Rica. Also open kind of like a clinic about the acupuncture studio there. So if someone interesting, if you live in around the Costa, you can always visit the Sam Wuest. Okay, Sam Wuest, pass to you. Thank you.
Thank you, Shifu, for that introduction. I'm gonna share my screen. Today, we're gonna be talking about meridians and points in motion, which is something. Can people see that? Maybe give me a thumbs up if you. Awesome. Cool. So meridians and points in motion. In Chinese medicine school, I went to Chinese medicine school after I had already, trained with Zhou Shifu for some time, for some years. I went to Chinese medicine school with a background in sports, in athletics. Before I was an acupuncturist, I was like a college sports coach, strength and conditioning coach, personal trainer. So I had a lot of background in movement and wanted to pick up some more background in medicine. And one thing that I noticed was that our curriculum, the bare curriculum that is standardized TCM, traditional Chinese medicine, in the United States, doesn't include a ton of movement. There's an emphasis on Qigong. Maybe you take a semester of that, depending on what school you're in. And some students do definitely go deeper, and some teachers do emphasize it. But some of the mechanisms for why these things work and where they come from sometimes can be a little mysterious. So I'd like to, first of all, demystify some of the background behind, the link between movement and medicine in Chinese medicine specifically. And then I'd like to point out some ways that we can all benefit from a little bit of knowledge about meridians in the body and how they can actually help you. It's not something random. It's not something haphazardly placed down. These two things develop together over the course of thousands of years, really. So the first recordings of therapeutic movements, which we can call Daoyin, were recorded on what is now known as the Daoyin 2. This is like the classic of Daoyin. It was not initially called that. That is a modern name, but this was well before the birth of Christ or however you measure time. This is way thousands of years ago, and it got dug up within the past couple of decades from a tomb. And you see in it movements, if you take a look at the picture, that look very similar to modern movements that we might see in Baduanjin. Some movements that look very similar to yogic movements. Actually, these predate the first written records of yoga asana or yoga movements in images by maybe 800 years. So very, very old and very, very profound discovery to see all of these things in ancient China. And this is the first real record of what we might see as Daoyin. So what is Daoyin? Daoyin is something that's been defined a little bit differently in different time periods in the past. And usually probably one of the best ways of talking about it, maybe two definitions are relevant here. One is guiding the qi to make it harmonious and pulling the body to make it supple. So there's an emphasis on opening up the body and also some guiding. So that may be through the breath, that may be through intention, that may be through a variety of means. And this quote is from the Jin dynasty, actually. There's an emphasis on pulling deviant qi out of the body. So at various times throughout history, remember this is several thousand years old, it was thought that we were pulling out. It could be cold, it could be dampness, it could be stagnation. Stagnation is one that I'm sure resonates most with modern audiences, but also there's cold and stiffness in the low back, for example. How do we pull that out? And even sometimes it was thought that they were like a spiritual sort of entity that we needed to take out of the body, and that's what was causing pain. So the last one that sometimes is brought up as far as in regards to Daoyin is that it's simply a means of movement as healing. And we'll get into a little bit more about how that takes shape later. So one of the first recorded written references to Daoyin is actually in the Zhuangzi, in the Warring States period. You know, that goes far as back as 475 BCE, where they make a reference to this person, Peng Yu, and his followers, who were talking about, you know, living a very long time through this practice of something that we would look very probably similar to Daoyin practice today, some combination of Qigong, some breathing exercises, some stretching exercises, pulling the body to make it supple. And actually Zhuangzi criticized that and said that's not the way to achieve enlightenment. You know, you can't just live a long time and make the body healthy and actually live a long time, but you and get your way to enlightenment. I mean, but that does show how popular it was even way back then, especially amongst the educated classes, especially amongst people that had the means and the time to do a few extra things. It even showed up in the time period of shamanism, way back. When we think about the animal forms that are so standardized today within modern Qigong, you know, they actually have precursors that might have been seen in the times of the shamans, when they were performing dances that looked like a turtle, that looked like a crane, that looked like these other things. It even shows up in the Daoyin too, where these precursors are actually, you know, several thousand years old for some of these forms that are now standardized and even promoted by the Chinese government. Something like the steps of Yubu, that is sometimes thought of as related or possibly part of where Bagua stepping was inspired by or originated from. That could be, you know, potentially thousands of years old. And that was talked about in texts that are 1500 to 2000 years old in regards to Daoyin exercise, that was referenced as an exercise and not only as a spiritual practice. So we have two characters here. I love the yin character because it looks exactly like what it means. Yin, pulling, so it looks like a bow and arrow. It's like pulling the body taut like a bow and arrow as a means of releasing something. And then we have Dao. This is not Dao as in Daoism. This is Dao as in guiding. This is Dao as in moving something along a path. This is Dao as in governing something. And so we're using the mind, we're using a method, we're using something to guide this process. We're not just haphazardly, you know, putting our hands on one person grabbing our hands, one person's like grabbing our feet and we're pulling. This is a very systematic and methodical way. Even thousands of years ago, you can see from the scroll, this is not, you could see this at an exercise gym. You could see this at a park. You could see this on like those parks that have like the machines laid out and they have like written descriptions of how to stretch. Like these are actually cover a larger span of the body than a typical even Western stretching mobility exercise would have at that time. So it reflects that people were really thinking about these things, taking them seriously, and developing them. About 186 BCE, there's a book called the Yin Shu that came out, which was a book of therapeutic exercise, and about 60% of these exercises were directed at treating pain or motor control issues. And so we can see, yes, there's a huge emphasis on the external part of the body with therapeutic movement, as well as 40%, that's not a small amount, we're treating something inside the body. We're treating respiratory ailments, we're treating stomach issues. And that's not to say that that was the only way or the leading way even at that time to treat diseases, but it is a way that does not need any more equipment than your body. And so that it gives it certain advantages, especially at certain time periods where herbs or medicine might not have been quite as readily available. We already talked about the five animal development, synthesized by Huatuo in the Han Dynasty. And then Daoyin was actually even adopted into the government-sponsored medical system during the Sui Dynasty. Dali Yang, who a lot of this research I'm reading off of things that she's put together over the years, because she's been wonderful in talking about these therapeutic movements and their history in China. And she notes that during the Sui Dynasty, there was a golden age of these exercises and movements where you were finding them written right alongside acupuncture prescriptions, right alongside herbal formulas. And they're very detailed, and they're quite commonly, if you list a disease, in one of the main books at that time, you'll see that right alongside the formula and the acupuncture, you see movement. And so some have a few more movements, more than one, some don't have any, but it's quite common and actually was government sponsored, which I think is a huge deal. Because, you know, we think in the West of movement as medicine in a way that the government actually supports it. And that's in the last, you know, couple decades with physical therapy. That doesn't exist pretty much for the entire rest of Western medical treatment as far as insurance is concerned and as far as government support is concerned. And then we have internal martial art development, which was heavily influenced by some of these principles because, of course, you have people that are getting injured, you have people that are overtraining and developing chronic injuries, you have people that are trying to coalesce an image of the body that can work well for a very long period of time. And so Taiji, Xingyi, Bagua mostly were developed, if you listen to more historical records over the past 200 to 500 years, if you listen to some of the more legendary accounts, you know, Zhang Sanfeng developed Taiji to some capacity, you know, over 1,000 years ago or so. And then Yue Fei for Xingyi would have been, I think he was like 1,200. And so it's still a few hundred years, but perhaps a little bit more ancient. So what are the channels and points? And what are we actually doing when we go to open up things with movement? So we have the layers from kind of superficial to deep. So we have cutaneous channels, which cover the skin area. We have the sinew channels, which comprise of the fascia, the muscle, the fleshy tissue that gets taut and works under stress, under duress. We have the luo channels, which are slightly deeper. The main channels, which are what we use in acupuncture, what we're primarily trying to affect with needles. We have the divergent channels, which again are deeper. And then you have the extraordinary vessels, which are like the blueprint of the human body and it's in respect to growth and development. How does the outside of the body connect to the inside then? So these layers are in constant dialogue with each other. The main channels, for example, if a trauma happens and they can't handle it, it'll spill way deeper into the extraordinary vessels. The body generally likes to keep disease contained as far away from the interior of the body as possible. And I'll get to a little bit about how it does that in a moment. But for our theory right here, when we can sometimes see, even at the layer of the sinew channels, a disease that's internal, we know that the sinew channels and the main channels are in really constant interaction. And the sinew channels are very much in alignment with the main channels. They're often running on almost exactly similar paths. If you look up acupuncture channels, there are some slight differences that biomechanically actually make quite a bit of sense. But for the most part, even if you just looked up and know from acupuncture school, the main channels, the 12 main channels of the body, you'd be able to treat sinew channel issues with some degree of competence because they run so well together. Let's see. And so one thing I want to note about this, and I have a little quote here that I used in another presentation before, the sinew channels are actually conduits of Wei Qi, sometimes known as defensive Qi. So in the body in Chinese medicine school, you learn we have Wei Qi, which is the attack, like fight the external attack, and the Ying Qi, which is the nourish the inside of the body. So it's more, one is more yang and one is more yin. And of course, the sinew channels are much more yang than some of the other aspects of the channel system. In traditional Chinese medicine, Wei Qi warms and protects the body and also initiates movement. In contrast with Ying Qi, or nutritive Qi, which nourishes and builds up our internal body and organs, etc., our Wei Qi is how we adjust to our environment, both in movement and also to diseases. We talk about Wei Qi being able to respond to outside influences spontaneously. This makes sense when we talk about disease, of course, because we don't feel what's trying to infect us until it gets to the inside. The vast majority of the time, the body is successful, actually, in fending off pathogens even before we're aware of them. Modern science actually has started to, in the past couple decades, recognize the role as fascia as far as an infection barrier. And so the skin keeps pathogens from getting into the body in the first place, but what happens when it gets past the skin? It moves into the fascia, and the fascia, when it's healthy, is actually able to kind of redirect and filter out a lot of those pathogens all on its own. The Wei Qi is said to flow in the layers between the skin and the flesh in traditional Chinese medicine, and that is not coincidentally where the fascia lies. So we can see that by opening up certain areas of the body, whether with needles or massage, and especially relevant to our talk here, with movement, This is allowing the fascia to optimize its patterning, optimize qi and blood circulation through this area that limits the spread of disease and illness, thus promoting immunity. And so the fascia is recognized as an immune barrier in Western medicine now, and the fascia is definitely included with what we think of as sinew channels. So what's an example of how we would use this knowledge of this interplay between inside and outside to work with a patient that has some issues? Let's say, for example, allergic rhinitis. If I have a patient come into my office and they often have so much inflammation in their nose that they can't breathe, some areas are traditionally impacted. So this area, right, if you can see at the base of the neck right here, right where a necklace would sit in the middle, the two spots right to the side of that and then slightly upward from that along the back of the neck are often quite tender, and you can palpate them on the patient, and those areas will often be locked up. And so the interesting thing, and I'll go through maybe a little bit how we do this, is if you can send somebody home with a prescription of, hey, let's mobilize your neck on a regular basis, it typically will help their symptoms that we might treat with needles in that area. Just treating by movement, it will typically help their symptoms because qi is more readily available to circulate through the neck and circulate along channels, for example, along the bladder channel here, that do come down and do connect to the nose. Other places that we think about, bladder 13. So that's if you follow the scapula, the big bone on your shoulder blade. If you find that crevice, that one part that sticks out, it's kind of a ledge, and you just follow that towards your spine, it's just right halfway between your scapula and your spine. That's bladder 13. And so we have these backshoe points that connect from the outside of the body on the bladder line to the internal organ. And so that's located roughly at the height of the lungs, where they're most readily pressed up against the rib cage. And so we do affect the lungs when we use needles in that area. And likewise, if you see somebody with, and this is not just allergic rhinitis, this could be asthma, this could be other things, we often have a lot of tension or even pain in those areas. And so actually opening them up is a quick and easy way to deal with that. The Mu points, which are the front alarm points, typically they're very tender if somebody has a problem in that organ. So you can see on the right side photo, that looks like me, it is me. We're gonna find often quite a bit of tenderness in that right inside where the shoulder bone sits, right underneath the collarbone. That area right there is often also going to be quite locked up. And sometimes it's also very closed. So people will adjust a posture that, because they haven't been breathing well, they fall into this posture. And then because they're not breathing well, they can't get out of this posture anymore, because this is not meant to be pull the shoulders back with muscle. This is meant to be the lungs naturally expand this area. And so traditional Chinese medicine actually knew this for quite some time and points out, hey, if they're not expanding that area, they're going to have problems in the lungs, or they've already had problems in the lungs. We don't really differentiate on that sometimes, especially in regards to movement. And then lastly, on the lung meridian, we take our thumb just at the base of our thumb here, right between the tendon, right underneath the base, and just following that right to the outside of the tendon and the elbow. That's our lung channel. These are lung 5 through 9. That area is typically quite tight and tender. And so what are some things we can do about that? In the Wudang 4-season Qigong set that Shifu actually teaches, I think it is the first movement for the fall Qigong, specifically around metal element, specifically around the lungs, is to place the hands on the back of your head, breathe in, and then hold your breath as you're opening up between your shoulder blades by moving your elbows to the front, and then flexing the neck, so opening up the back side of the neck. And so that's opening up bladder 13, that's opening up these Bailao and Dingchuan points. And that's incidentally opening up like the whole lung area. So using your intention to guide the qi through that area to open it up, and then using the body itself to pull like a bow and arrow and stretch out that area to allow qi to start passing through that area. And for me, actually, those who sometimes does struggle with this, if I have like a little allergic reaction to dust, that's a wonderful treatment. And I end up finding it really helpful with patients as well. The combination of like the breath holding of that exercise and opening up these physical areas that connect to the internal body. So here's a quote that I think applies pretty much exactly to the sinew channels, but from a Western medical standpoint. This is, fascia is the secret to healthy aging. Musculoskeletally, the elastic movement in young people is associated with a two-directional arrangement of a fascia, similar to a woman's stocking. So that means that the muscles are fibers are moving in a specific direction, and they're along this track. They're very clear in their directionality. In contrast, as we age, we naturally lose our springiness and gait. The fascial architecture takes on more haphazard and multi-directional fiber arrangement. And so you can see with this physical scar, you can see this in the case of injuries internal to the body. Both work in very much the same way. One is just visible at the skin level, and that's why I chose to use this picture. And the body starts laying down fascia and muscle fibers haphazardly. And so they're no longer quite in this kind of like springy alignment, like a spring aligned. They're kind of in this way where they're pulling in multiple different directions and not organized. And actually, we feel a lot older and we move much more poorly in that way. Animal experiments have also shown that the lack of movement quickly fosters the development of additional crosslinks in fascial tissues. These additional crosslinks we do not want. Remember, the fibers lose their elasticity and do not glide against one another as they once did. Instead, they become stuck together and form tissue adhesions. And in the worst cases, they actually become matted together. And there's no movement. It's just they're so stuck together. They're knotted up. You can't get them apart. There's nothing happening here. And so that's, to me, this is like what like the Baduan genius and why that's so popular. We call it Qigong in modern times because of Qigong fever in the 1950s and how that is. But really, in historical terms, it would be more aptly described as a form of Daoyin, because we're opening up specific parts of the body. And you look at this very popular set and you see how it's opening up different fibers of the body on different arrangements, on different meridians. We're opening up the sinew channels. So there's really nothing. And that's the beautiful thing about that set. And I don't practice it daily or anything, because I have other things I really love to do. But why anybody who does, I respect it, because it hits so many parts of the body in one particular set. And that's why it's so popular, is because it is just relatively complete. And so what does movement, what do these movement arts do, and how does it impact our internal health? And so by repeating stressing fascia and particular movements, we reshape and align it. So by reshaping and aligning the fascia, remember, we can sometimes think about the sinew channels and the fascia and the musculoskeletal system as the highway that the energetics of qi run along. So oftentimes in the body, when we see when we see a channel, and I'll just show my arm close to the camera here, you'll often see a crevice where that channel goes. And it's going between things, as opposed to going like through the bulk of a muscle. Usually, even if it's going through a muscle, it's going through like a cross section of that muscle. It's not going directly through the bulk. And they're going vertically, which not coincidentally is the way most of our muscles and things are running. So we want them to be arranged in a particular way, and that actually helps our energy to flow, that helps our qi to move, and that helps us to avoid stagnation and everything in the body to just work more optimally. And stretching soft tissue activates a systemic hormonal response. This is a really interesting one. I don't have a lot of research on it because there hasn't been a ton of research on it, especially in regards to movement. But one of my teachers in her book, this is from Claudia Sitkovits, she specializes in birth. And she notes that when women undergo labor, it's not only that there are hormones already in the system from the pregnancy and everything like that. Yes, there are. And also, when certain tissues in the body begin to stretch, there's a hormonal response. So the body, by proxy of knowing, okay, this is opening up, there's a response to it. And that can actually be even hormonal, which is something that has not been very well explored in the rest of the body, but I would imagine actually has a similar, if lesser, effect. Because we do see when people are stretching, even just basic Western stretching, they're increasing serotonin in the body, for example, and that's going to make you feel good. So this stuff does have a byproduct of enhancing your well-being. And I know that I'm not the only person engaging with these arts, at least partially, and because they give you a very good feeling in your body. And I already touched on sinew channels, fascia, and immunity. So Daoyin's influence on internal martial arts here. This can be a way of understanding a little bit the panacea that we sometimes associate with internal martial arts, such as Taiji, such as Bagua, such as Xingyi, where it's often very well noted that like the practitioners that have been doing these things for decades often have like very good health, and it's more than just they're strong or they, like can hit people. Like that's, we know that about boxing and NFL players, but they're not living very long. And it's not just about not absorbing head trauma here. This is understanding that by repeating movements along soft tissues along the channels, we're aligning these fibers. And so that's why we see some of these effects, like, like a Taiji practitioner who has like long hair that retains its color until old age or something like that, where we see these kind of internal effects. One thing that we can note from some of these systems is that we often go from big openings to nuanced technique. And this is something that within the Wudang system of internal martial arts that even Shifu would emphasize to us, is that from the beginning when we're practicing Kung Fu, it's more about opening up big amounts of mobility, being really big, really open. Often this is a picture of a position in Fu Hu Chuan, where we're like not just bringing the hand by the face, but we're actively rotating and spiraling, and these counter spirals actually end up filtering their way into the soft tissues of the body. And so we're not just at a certain level of practice, we're not just opening up the sinews, we're actually kind of opening up the ribs, opening up the spine, opening up even the soft tissue that's around the organs. One thing that's interesting that maybe I should have put a slide on, but I can talk to you about is the fascia is really interesting because it runs and encapsulates each individual organ as well. So, and the interesting thing about fascia is like pulling on my shirt. If I pull on one side of the shirt, the other side gets pulled. And so when we pull in this sort of wide open stretched way, coupled with relaxation, coupled with expansion, and a couple other principles, we actually are moving, both mobilizing and stretching the fascia around some of these organs. And so that's a really interesting way that during these internal martial arts in particular, where the focus is so internal, and we structure practice in a way where we don't have to constantly be thinking about an external opponent, we can really get to some of these deeper layers, both in terms of helping us with power production, both in terms of helping us, with technique and form and whole body relaxation down to the core, but also in terms of the health benefits. This is, I think, a big part of why they work the way they do, their mechanism. Yeah, so that's internal and external focus. And then also knowing that intricate knowledge of body spirals, toric rotations, relationships between distant areas. And so I'm going to show in a moment a demonstration on how these three harmonies can work. And so the three harmonies on an external level are the wrist and the ankle, the elbow and the knee, and the hip and the shoulder. And so, and when we practice something such as Taiji, but I think this is actually universally true to some extent, because we see it in Olympic athletes in track and field, for example. Their spirals between their hands and their feet match on different sides of the body. And so we can see that that's actually patterning something that's happening inside the body as well. And we're going to be able to feel that in a moment. And the other thing that I think is really interesting is we mentioned in that 4-season Qigong exercise where we're opening up here and we're opening up this area in the back of the lungs so the back of the ribs can expand. We're opening body cavities with some of these drastic movements. And so we're opening the ribs. We're opening by virtue of structuring the body a particular way. We're opening the low back and the lower spine so the kidneys can breathe better. So our lungs can be more open. So actually the fascia around our heart is not so constricted and locked. I don't know if anybody else, when they work on the computer for a long time, their chest like just doesn't, it's not like it's pain for me anyways, but it's like, it's just not open. And then I go outside, I go for a walk, I might do some stretching, put my hands on a door, and then, yeah, this whole area, I can breathe again. I feel comfortable. I feel like my circulation is better. And that's real. That's it's not like gonna kill me in one day, but that's a real thing that happens when we constrict ourselves in that way. Yeah, one other note that was so cool in Rory's presentation earlier was he was talking about the direction of channels moving in this sort of direction, and that when you, in grappling, grab someone here, you're cutting off a lot of our strength because you can't move towards the thumb from this position because we want to be moving here. And so in the same way that when we throw a ball, one way to protect your shoulder is to let the thumb pass down at the end. If you watch an NFL quarterback, they're often there. And that's one of my coaching mentors in track and field when we would do initial like med ball throwing drills. Imagine a ball over my head and we're throwing it. that's one way to protect the shoulders, is to ensure that we're pronating. And the same thing, but slightly different with the feet, where every time you take a step, you're shifting your weight a little bit to the inside of the foot. So it's constantly in this toric motion. It's constantly a spiral. And if you ever try to go run just on the inside of the foot, where are you going to go? Like, it's not going to work so well for you. If you try to run on the outside of the foot, your body might even reject it, because there's just really, the bones are not big enough to support your weight there. So we always kind of are working in these spiral motions. Internal martial arts tends to take advantage of those, which is why I like to geek out about them. One of the reasons anyways. In a moment, I'll do the demonstration. So why do points matter? For one thing, they're affected by proper structure. So these points, acupuncture point, sometimes the translation is qi shui, which means like a cave of qi. And so often an acupuncture point, like, oh, we're in between the tendons. We're at this big hole right in here for pericardium 6, or we're at like Laogong, the center point of the palm, or we're in these kind of knuckle areas here, for example. And often when acupuncturists are looking for a point, we're looking for a hole, someplace where there's not a thing versus when there's like a big thing. And so these holes are obviously influenced by this stretching of the fascia, and so but the stretching of the sinew channels. So when they're nice and open, they're more likely that the holes are nice and open and supple and everything like that. And if you practice Chinese medicine, whether it's massage, or even casual massage, you often feel some of these points when they're diseased, and when it's the right point, often you'll feel like an excess or a tightness or a lack of flow at these points. And so often that indicates to us that they need that point. But if we keep our sinew channels a little bit more fresh and clean through movement, by cleaning them up on a regular basis, we might need less acupuncture. And I would posit that yeah, we do need less treatment if we help ourselves. They're also useful landmarks for movement. So sometimes we use areas of the body, such as the Mingmen in the lower back, to describe an area of the low back that should be open. And we're not talking about the specific acupuncture point that is one specific point in between these two vertebrae when we say that, but maybe sometimes we're talking about a more global area. Might say that about the Laogong point in the palms of the hands in regards to Qigong, where we can feel Qi here. It's usually not exactly one point, but maybe more of a spiral sensation around the whole palm. So these are useful landmarks to describe some of the sensations or to even teach movement. And then they're also useful to promote recovery. So it's really like to be able to stimulate them, to like slap certain areas like the crease of the elbow, to like go in there and massage an area that might be stagnant and tight. These are really interesting ways to open up the body. So let's see. Yeah, so let's go right into, we're just going to do, I think we're going to do two things right here. The first one, we're going to get into a standing posture in just a moment. I'm just going to talk through it, but you can move to a standing position if you'd like. And we're going to practice opening and connecting to the spine, connecting to a particular point in the Yongquan point. And one thing that I wanted to go back a couple slides and make sure, and so we're going to do the 3 harmonies demo after, which is going to be connecting the shoulder to the hips. So find a little space, because we're going to do three short demonstrations here. 3 short demonstrations. So I'm going to make sure that you can see me. Yeah, that looks okay. So the first one we're going to do is we're going to, and Josh actually was kind enough to lead us here this morning, and we're going to go into a little bit more detail on some standing postures. So the first one, before we even do anything else, I'm actually going to have us rock back and forth. And so moving forward, we're going to start to have to grip with the forefoot and the toes. And moving backwards, we start to have to grip with the heels a little bit. And so make these nice and big and noticeable. Relax the upper body at the start. And as you go, make the rocks slightly smaller, slightly smaller, slightly smaller, until there's almost no movement. Until your feet don't have to turn on just to stop you from falling. So you might be getting close to a balance point here. And what you'll notice is in this position that you might be able to relax a lot more. Pay attention to the bottom of your feet here, because usually on that balance point, you're not going to find yourself all the way on your heels. You're not going to find yourself all the way on your toes. You're going to find yourself somewhere in between, perhaps underneath the ankle bone or a little bit forward in the feet. And so you'll find from here, it's almost a natural reflex that your body can just lift the arches just slightly. And if you struggle to just like grip the ground, again, with the palm of your foot, not with the fingertips or the toes, just gripping slightly to raise the arch just a little bit, make that area active. If you struggle with that, you can also reach up through the crown of the head. That pulls up on the pelvic floor, and pulling up on the pelvic floor pulls up on the arch, again, through that system of fascial connectivity. So maybe just relax for a moment, and then even if you didn't have trouble connecting to your feet, pull up with the head as if being suspended from above or buoyed in water. I love Larson's analogy there. And then that should pull up the pelvic floor slightly, and that'll pull up on the arches of the feet. And try that, just relax, and then find that sensation one more time. And that already starts to activate this sinew channel system within the body. From here, we can start to practice syncing. So one thing I like to do before I go through a little visualization is just take a big breath, a purposefully chest-full breath, where we lift up the rib cage and kind of throw out our posture a little bit. And then exhale, and I really want the rib cage to drop and sink. You can breathe through the mouth on this exhale. Do it 2 more times. Inhale. Exhale. Let go. Really let go of this rib cage. The stuck rib cage inhibits our posture. We can't have a good spinal posture if our rib cage is messy. Inhale again. And exhale. Let go of the ribs. Let go of the shoulders. So from here, again, connecting to reaching up through the crown of the head, relaxing the shoulders, maybe shake out your arms just gently to let them sink down towards the floor. Shoulders, elbows, hands, fingertips sinking down. From here, making sure that our breath is sinking down to the lower abdomen by pulling up on the crown of the head, letting the breath sink, and then letting the pelvis feel like there's a weight attached to the back of the pelvis. Rather than just forcing under, kind of doing a pelvic tilt, just sink down. And there's almost like a little sit that happens in the hips. And I'd rather you feel it in the hips first before the knees, but I need you, when you sit down in your hips, to feel the knees unlock. They don't need to be in a horse stance. They can't be straight. So as you sit back into your hips, feeling heavy in the pelvis, unlock the knees. And notice as you change your body structure, where your breathing starts to go. It's very normal. You can place a hand on the lower dantian, or we'll say navel for right now, and the low back right behind it. Make sure you're breathing there. And make sure the Mingman, or Do 4 acupuncture point right in the center of the low back, kind of the most inner point if you were to stick out your butt to make your butt look bigger on Instagram, is going to be right in that hollow point in the low back. Make sure that area is open. We don't want to have that area closed and pinched off. That actually inhibits our life gate fire, that inhibits our kidneys. It allows them, doesn't permit them to breathe. So we want to take a moment here and just drop our attention to our lower dantian, making sure that we're expanding in 3 directions here. Front, back, sides. And then from here, noticing any sensations that come up in the body. If you practice for a long time, you may already have some chi sensations. Maybe it's different for different people, but for example, when I get in touch with that area, because it's stimulating channels and nerves in the low back, my feet start buzzing actually on the ground. So everything is really connected in that way. And you can stay where you are. I'm going to change my position just to demonstrate the next movement in an effective way. So we're just going to have our hands come out to the side, palms down to start. And we're just going to turn one hand, both hands up, but in opposite ways. So I'm going to look towards my left hand, and my left pinky is going to turn up, and my right pinky is going to turn, my right thumb is going to turn down. So just starting with that, we're not going to move the body too much right now, just turning the hands. And we can time this with the breath. Exhale, look at the hand, inhale, come back. Exhale, look at the hands, inhale, come back. I think folks have it at this point. Just rotating the hands to start, and start to feel that rotation come deep into the body. So I'm not just rotating the hand to turn this left thumb down and this right thumb up. I'm rotating from inside the shoulder joint as I turn. And so I'm going to add to that. Again, we're demonstrating how these lines cross through the interior of the body. And instead of thinking about just rotating, I'm going to rotate and pull fingertip to fingertip, like wringing out a towel. So I'm actually, you can see on the screen, I'm physically getting, maybe 2 inches or 5 centimeters more of width as I go here. Trying to poke something in opposite direction. Sometimes it's useful to have a goal to move towards. Rotating inside the body, you might start to feel a different sensation in your chest, underneath the collarbone. And then I want you to reach, but now reach to the side. Shift the weight, try to get as far as you can, and then come back to center with an inhale. Rotate from inside the body, reach. Come back to center. Rotate, reach, keep going. Come back to center, rotate, reach. And we're going to add one more wrinkle. We should have our knees, remember, unlocked here. And now as we reach, we're going to turn my knees straight ahead. I'm going to turn from the hip joint. So as I rotate the shoulder to move into this position, I'm also going to rotate through the hips. So the hip that I'm moving towards is going to close, and the back hip is going to stay open to keep my knee over my toe. And so this is coordinating the shoulders and hips in this crossbody, the 3 harmonies way. Back to center, rotate, and notice what that starts to do if you really try to focus on opening and closing the joints in unison. So the hand that's moving up and the opposite hip are opening, and then again the crossbody as I move here, this is closing together in coordination. You might notice if you do this for a little bit of time, get into a bit of a flow state, you might notice that they assist each other. You might notice that you can coordinate them. And a lot of these small motions, this is a very obvious way of doing it, do end up showing up in Taiji, Bagua, Xingyi as well. Whether they involve the whole body or just specific limbs. But we're building these little patterns into the body, and we'll finish in a moment. Good. And just relax and shake it out for a moment. So that's one way that we can start to think about these 3 harmonies. That's one way that we can start to think about using the fascial system and connecting it. Another thing we can talk about here and take a look at your screen so we know the point is this point Huantiao. So this is a point that's excellent for hip pain, for back pain, also tonifies the qi in the body as well. And we can see when somebody is a skilled mover, whether that's internal martial arts or here we have a Olympic level sprinter, they're actually going to rotate and find themselves a little more space in the hip as they go to move. And so they're opening up the lateral hip. And again, this is that torus flow. So we see instead of just moving straight forward, the athlete will actually drop one hip and find that spiral. Again, this is toric flow that we always see in movement because that's how humans work. And so we're actually going to practice that in a moment. First, we're going to locate Huantiao. So we can see, I don't know if you can see the little yin yang on the body. You can find the bottom of your tailbone and move towards the outside hip bone. And so usually this point is going to be quite tender. And so usually we're going to find, you can start again at the outside hip bone or tailbone, and about 2/3 of the way out, there's one point. And you can take this knuckle right here, make a little fist, and just give yourself a little tap on that area. You'll know when you hit it because it's tender. This is actually a great way, not only for demonstration purposes to show where it is, This is a great way to massage it as well after practice, after doing some sort of exercise, because you're opening up a lot of qi and blood circulation in an area that can often get quite stagnant, especially in a society where we do a lot of sitting in cars and sitting at the computer. So maybe you want to do 30 or 50 times just tapping this point. If you really get it, for a lot of people, you'll end up feeling a shooting sensation down the leg because there is a nerve underneath it. And that's good, that's great. Unless it's painful for you, in which case be really gentle, maybe use an open hand instead. But if you can get that sensation, and often it feels very good. So we're going to do a little demonstration that involves hip hinging. So for folks that go to the gym, they know that, one of our main basic movements for strength conditioning is going to be a hinge. So one way to coach a hinge differently that takes advantage of some of these spirals, and actually we can think about opening up this area around Huantiao to promote health in the hip, is we can take, I like to put like a bench or something in front of my knee, because the easiest way to make sure you're using your hip and not a bunch of quad is to fix your knee in place. So I'm just going to bring my knee forward here for a moment. My weight is a little bit front of my foot. My back foot is just on the toe. Just kind of kickstand for balance. And so I'm just going to hinge forward. Hinging from the hip and then come back up. The focus can be making your butt as big as possible. So that's putting already this kind of front to back length through the hip. And then the other one, which I'll change my angle to show you, after we've gotten a little bit of the hang of, again, making this area big, open, expanded, is if we look at it from a frontal plane, from this angle, I want to let this hip, the free hip, drop a little bit down as I hinge down. And so that's going to open up this whole lateral area as well. Instead of just going front to back, this is actually a three-dimensional movement. And remember to keep your knee. For this exercise, for this hinge, it's really helpful to just keep it stuck in place. Do not let it start to stand up. And just maybe sometimes it's helpful to reach towards the opposite toe. Sometimes it's helpful to put a hand on the back. And that way, by putting a hand on the back, you can feel that the pelvis is sloping downward. And so we can really take advantage of the channel system and open up this whole gallbladder channel. You might not just feel it in your Huantiao gallbladder 30 point, you might feel it all the way running down the leg. And that's something you can experiment with, if you like to do gym movements. Internal martial arts, we find these rotations slightly differently, but the principles are, again, roughly the same. So some points that are useful to promote recovery, and I think this is about where I'll finish up. The back shoes. So these points, the paraspinals, from the low back to in between the scapula and between the shoulder blades, these are wonderful points to keep supple and loose, because these directly impact the function of organ health. It's pretty much like between that and the spine. If somebody has an internal issue with their liver, at the liver back shoe, there's a tightness or there's an aberration. Somebody has a lung issue, it's there. If somebody can't sleep because they have heart blood deficiency, you feel something right at T4 or T5, like right where they say, the heart is treated by the governing vessel, which is in the center, or the bladder channel, which is on the sides. And so these are great areas. If you don't know what you're doing, do the whole thing. You can really support your health just by keeping this area loose and supple. The Xiaoyang channel is specifically interesting for movers, and that's the lateral side of the body. So like, for example, I know a lot of runners that will always be rolling their IT bands. One reason why people love to roll their IT bands is because it relates to the gallbladder channel. It's right on the gallbladder channel. And what does the gallbladder channel do? It can relax the sinews of the whole body. So not just its only its channel, but it can also help relax, channels that relate to the low back, and help relax things that go up to the shoulder. It can relax all these things. So the side, especially the side of the legs, but really the side of the whole body. And again, you can look up Xiaoyang gallbladder channel, and then also the triple heater channel as well, if you want an image of how to do that. And then massage techniques for general recovery. And this is where I'll stop the share so that you can see me better, because I realized that probably was tiny, and that was my mistake for the demo. yeah, you're gonna see. I'm gonna show you two more things to finish up, and then these you can put after a workout. It's nice to get chi and blood circulating again after you've exercised, after you've trained for a while in martial arts. Either way, some schools include them in different fashions, and I can show you a version of that here to finish up. So the first one is bladder 57. So this is another point that opens up the sinews, and that point is right below the big meaty part of the calf. And what you're going to do is you can just kick that point to stimulate it with the instep of your foot. So the side, inside that you might kick a soccer ball with, just kicking that point. And you can do that. It's a nice way to cool down from a run if you just went for a run, because there's often a lot of stagnation in the calves, and we use this lower leg complex quite a bit. So you can do 30 steps just walking back into your house where you're kicking the back of the leg. This is also useful if you're a martial artist and you get kicked a lot here for leg sweeps. You can raise the intensity and really kick yourself to build up some resistance to strikes. But for our purposes here, it's more about promoting circulation, especially in the lower part of the body. And then we can do a little slapping massage. So we can go down the inside of the arms and go up the outside of the arms, just slapping each part of the surface. This is matching the circulation of the channels. So we're moving down on the inside of the arms, up on the yang side of the arms. Maybe we'll do 3 of each side, and then we'll move to the legs. It's a great way to restore circulation, especially, we can do all this stuff with a foam roller and massage tools and forget that we have tools that are just our own hands that can get quite sensitive and skilled, even just by putting these into our daily routines. Patting down the chest and abdomen, maybe take a moment around dantian and the hips, moving to the low back. And then again, just 3 times for demonstration purpose, down the backs and side of the leg, up the front and inside of the leg. Moving down here and up. So you might feel a little extra circulation after doing that. I know my hands feel warmer, certainly. Even my feet feel warmer because of opening up the leg muscles. And so this is a great way to cool down or even warm up. And so I think that's where I'm going to leave it today, so that we have enough time for Master Joe's talk. And thanks for checking in. Let me know if you have some questions. I'm supposed to be the moderator, so.
Okay. Oh, Sam, thank you. It's very, very great. You combine a lot of things like martial arts, combine with the healing, all the things. This is great. I always talking to the student, everyone about that. So this is a life. You always have to learn something. Why you learn something? Benefit your life. What do you do? How to benefit your life? You are as a healer. It's the same like an acupuncturist. Always think about something. How to can benefit, can help you. What do you do? This is a very, very great. So from beginning, I have a question. All the life, everything from acupuncture, either you are a healer or you are acupuncturist, same, whatever you do. Can you share, for your acupuncture, what, did you healing someone? What kind of that happened? What's the problem? What do you movement use, or what kind of acupuncture? What do you use? How to healing them? Something like that story. So stories experience.
Yeah. So I think one way that I'll start off is one of the things that I do in my clinic with anyone who's a mover and athlete. I'll start with pain, and then I'll move to a more internal example. Is if they come in pain, of course I'm paying attention to where the pain is. And what's happening, but I'm also going to do my own kind of mobility testing and watching them move, watching them specifically walk or run, or to do the thing that's hurting them. If they're a tennis player, I want to see what it looks like when they swing a racket. And if they can't do that in front of me, I'm going to ask for a video or something like that. And what I want to see on that, and this is really where the sinew channels are very easily diagnosed in this way, is if, for example, somebody struggles to bring their knee to their chest, or to raise their leg, like to do a hamstring stretch, they have some sort of restriction on their bladder channel. Or maybe they have their hamstring problem, and I ask them to put their neck forward, and they tell me, oh, for some years ago, like I had a neck injury, and actually, like, so I think, oh, like maybe they've been trying to stretch this lower end of the bladder channel, because remember, the bladder channel runs from the, you know, from the eyes actually all the way over down the head to the bottom of the foot. It's basically just the whole backside of the body for our purposes here. And so, for example, I'm going to start to use that information of how the channels work to start to look for, okay, maybe it's not the dysfunction is not in the place where the pain is. So I might look for it in a different place. Or, for example, I had I had I think it was last fall, but maybe a year ago now, actually, where I had like 4 patients at one time that all had ACL tears. And so the ACL in the knee runs across the stomach and spleen meridians, and the stomach and spleen meridians also run across the hip. So they all actually were dealing not with knee pain, but with back pain. And so what I found was, instead of treating, because a couple of them got good results from normal back pain treatment, and a couple of them really didn't. And I had to think about why. And I realized that that whole channel was all locked up, but the area that I was normally treating for back pain wasn't working the same, because it wasn't where the problem was. The problem was actually at the knee. And I actually did a lot of treatment for one in particular, where we basically just worked on his knee and his back pain went away. And that's understanding the way the channel system is working, to kind of creatively hunt for a different for a different area that we can more easily go after. And the same is true for when somebody has a pain on one meridian, and when I do some testing or watch them move, they're missing mobility in a different meridian. Maybe they have neck pain, but you know, the only movement I can find that's not good is their rotation in their hand. Oh, if I can't rotate here, this is my small intestine channel that's locked up, that isn't moving. And so actually the small intestine channel goes into the neck. And so maybe I just need to treat the arm and the shoulder, and the neck pain will go away, or the other way around. And then the second way I'll answer it is for internal health. And sometimes with people who have internal health sort of issues. One thing that really is helpful for people with asthma or breathing issues is to do some breath holding. So some Daoist exercise, or even just walking, and you know, after an inhale or after an exhale, do some holds of the breath, and that can really help them expand their lung capacity. And there's also like this kind of panic response the body goes through, feeling like they can't breathe, so they breathe more, and then they make things tighter. So it's like this cyclical process that they keep having more trouble breathing. So getting them to experience like moments of breathlessness both changes the chemical composition of the blood, so the body is not over oxygenated, and that's actually like Oxygen Advantage would be the book for that. And then also just experiencing that, I think psychologically also makes someone not like be like over breathing and breathing with their mouth and breathing up here, because subconsciously they think they're drowning all the time because they're not breathing so well. But I mentioned the fall Qigong set because I think that Qigong set, especially the first movement, if I have no time to move anything else, that first movement I think is wonderful because it incorporates a breath hold and opens up areas that are almost always tight for people with breathing issues. So that would be an example.
Yeah, that is really, really great. It's, we're at the conference, wherever. It's just the idea, the acupuncture, not from book, it's from people or person. That's why. So either someone went to the school, like study for many years, but it's important to follow someone have acupuncture like a few years, then that will be the best. It's not, I studied this from books, then I can be an acupuncturist. No, it's not that way. It's acupuncture, everything acupuncture. That's great. Anyone have questions? If you don't have questions, we can stop like a few minutes. okay, this is great. Look like nobody have a great questions. Means you did great. So okay, maybe we stop around like 5 minutes and drink a little bit of water, then stir again. And yeah, next presentation, it turned into me. Okay.